So what I wanted to add, and it's really about what I was saying this morning, which is in at Mayo Clinic and in the city of Rochester, we've been going down this path of trying to change our city to support the idea of America's City for Health. So we went to the legislature. I carried the legislation when I was there. We passed this economic development bill, which is supposed to prepare our city for the future of healthcare. Midway through, of course, it's a 20-year plan. Midway through, and actually it was 5 years in, the pandemic hit. Um, a little bit of a pause. We weren't sure what to do. And so what we decided was to continue, despite the fact we couldn't gather, we could continue with the construction portion, the transformation of our community during that time. So we moved ahead and we're working on the built environment in our downtown. Now we're at the 10-year mark, and this was just quickly from that very first slide. And we're pivoting a little bit now. We've built some research labs. Those continue to develop and grow, and people are filling them. But we've decided to do this. We're back to this original notion that we are America's City for Health, that we are going to make sure that health is used, as it says on the slide, innovation as an economic engine. We talked about that earlier this morning. Health excellence as an attractor, because we don't have an ocean, we don't have mountains, we're in the middle of the Midwest, but we do have the best healthcare in the world. And so if we can draw people to our community and really think about the research that Mayo had done, which showed when people came to Rochester, they loved the healthcare they got and they liked Mayo better the longer they were there, Mayo Clinic. They came to Rochester not sure what to expect, and I can tell you from talking with citizens, sometimes what they expect is kind of scary when I talk to them and what they thought Rochester was. And most recently, a guy said, "I really love this. I'd stay here." And that's what we want. We want people to come to our community and love our community, because the data showed the longer they stayed in Rochester, they were bored, there was nothing to do, on and on and on. So we are trying to change all that. In addition, the final blue heart, we want health in our built environment. So we're working very hard not only to change our unified development code so that when you build in Rochester, you're building with the idea of creating that healthy community and environment. I've been working on little things a mayor can do, which is work on Move with the Mayor and community health, work with doctors at the Mayo Clinic, like one of the cardiologists that I deal with quite often. The data that was showed earlier on diabetes, obesity, which is an issue I've been dealing with since I was on school board. I hate to tell you how long ago that was. And we haven't even made a dent in that. Right? The numbers aren't changing in the right direction. And so what can we do as we develop our city to make it be a healthy place to be, to make it be more walkable, more bikeable? I work with a couple of Mayo trained physicians that have their own small, tiny little clinic in town, and they do a lot of work on what they call lifestyle medicine, which is preventive medicine. How can we keep people out of the hospital? We have the best hospital in the world if you need the care. But let's do what we can as a community and as an environment and talk about keeping you out of there until you actually need it. Right? And then it's there for you. You can get that great care. So right now we're talking a lot about changing the built environment, and I will just kind of close because I'm not going to spend any more time. But my visit to China in 2023, it was a revelation to me how much China has done on the built environment to keep people out of cars. There are plenty of cars, yes, but out of cars, unlike the United States, where that's our primary mode of transportation, on buses, on electric scooters, walking and biking. And you've created an environment in China that makes it safe and easy and desirable to do. And so we are looking in our community to say, what can we do to not be so car-centric, to create a medical district? I loved what you were talking about. We have our downtown as our medical district, but to create one that is safe and healthful and really deals with that idea of lifestyle medicine. So we've got a lot of work ahead of us. We're halfway through our 20-year plan, and I'm really looking forward to inviting all of you. You can come anytime for the great healthcare, but between now and I'd say 9 years, 8 or 9 years from now, will look very different and hopefully not only provide the world's best health, but be the healthiest city in the country. So that's our goal.
Thank you, Mayor Norton.